Philadelphia is the county seat of Neshoba, a quiet town by many accounts with an unemployment rate of just over 6%. But the median household income is some $20,000 below the national average. It is perhaps the bedrock of the growing medical coverage plight in rural areas of the state, with so many people who do work but don't make enough for costly health care coverage and now make too much to qualify for Medicaid coverage.
I think the average Joe would be shocked if they knew how many rural hospitals were literally on the brink financially.
Dr. Andrew Dabbs works the floor at Neshoba General Hospital that has closed an entire wing because of a lack of patients and growing costs. In many cases, the surgeon says he doesn't see patients until they get really sick.
People come in with diseases that should have been seen before, but they just financially didn't think they had the means to get it taken care of and delayed their care.
And that compounds the narrowing health care margins for the only hospital in the county, aside from the one for the Choctaw Indian Reservation. According to operators, since the state refused to expand Medicaid coverage for more Mississippians, this hospital is in the red $1.4 million for this year alone and has lost more than $11 million over the past 10 years just in patient revenue.
Greater than 30% of those that we see in our ER are unable to pay for their care.
But the hospital has to accept those patients, even if they can't pay a medical bill. Lee McCall is CEO for Neshoba General that has seen a dramatic spike in healthcare costs, what it has had to pay to keep staff in place, and the number of patients that fall under that very definition of uncompensated care.
You know, how many businesses out there are willing to open up shop and go to business making 2 cents on every dollar that they spend? Well, that's what we face in healthcare, especially in a hospital setting, is the margins are razor thin.
Mississippi is one of 12 states in the nation that still has not expanded Medicaid, about to be one of 11 when South Dakota does do it later this year. Much of the staunch opposition to expanding Medicaid in the state has been the perception that eventually the feds will increase the costs on states that do expand.
Well, we've been very clear that we're not for Medicaid expansion in Mississippi for a variety of reasons. That's not news. That's a position we've maintained for quite some time.
The House Speaker has taken a no-budge approach on Medicaid expansion, with the state already spending more than $1 billion on the program.
There's a philosophical opposition where some people say, wait a minute, we're putting, in many cases, healthy, able-bodied people on a program, a federal program that was originally designed for the sick and the disabled.
State Senator Joey Fillingane does not support Medicaid expansion in Mississippi, but he is leading a measure on the Senate side that would allow hospitals to pool resources in rural areas. There is also a measure for grant money to help those hospitals offset their losses in rural areas.
Once we allow our hospitals to actually operate more efficiently and more nimbly, then we give them monies that helps bolster their bottom line for now, and hopefully as the rules change and they can get more nimble and more economic about their approaches to providing health care, then I think you're going to see a lot of them thrive.
But hospitals like Neshoba General say it is not thriving, but battling to stay open. One of an estimated 38 rural hospitals in the state that the state health department says is in danger of closing without some form of financial help to bridge a widening health care cost ravine for rural hospitals in Mississippi. Scott Simmons, 16 WAPT News.